Hello everyone, my name is Tyler Cunningham. I'm an actor and workshop facilitator who in the more recent years of my life have become very interested in nutrition, mental health, diet, history and the effects that history has on your nutritional health and your mental health. And so I'm very pleased to be sitting here today with Dr. Jenny Goodman, who has been practicing ecological medicine for over 20 years. In January 2020, Jenny released a book called Staying Alive in Toxic Times. So Jenny, could you tell us a bit more about yourself and about the book that you launched this year?
Hi, so I'm Dr. Jenny Goodman and I qualified from medical school way back in 1982, but as Tyler said, for the past 20 years I've been practicing ecological medicine. That means looking at both the nutritional and environmental factors that are impacting everybody's health. So I work with diet and nutrition, food, vitamins, supplements, but also looking at the toxins that are affecting us all. After 20 years, I decided it was time to try and summarise everything I'd learned for the wider public. So that's why I published the book, Staying Alive in Toxic Times. The subtitle is A Seasonal Guide to Lifelong Health. And I think we'll talk about seasonality, what it is and why it matters later on. And the purpose of that was to empower people to improve their own health, but also to look at why we need to be improving our health in the first place, why so many people are ill, the environmental and nutritional causes of the many pandemics we're experiencing. So COVID, but also cancer, heart disease, diabetes, dementia. So nutritional medicine is about looking at causes, it's about believing the patient, and it's about treating the whole body and the whole person as one joined up ecosystem, equally part of the ecosystem of the planet we live on.
Would you call that holistic medicine?
It certainly is holistic and it's certainly scientific. But today we're going to focus, I think, just on vitamin D.
We are indeed. So, Jenny, what is vitamin D and why do we need it?
Okay, so vitamin D is a substance that we make naturally in our skin from sunshine. In fact, what the sunshine does is it turns the cholesterol under our skin into vitamin D. The full chemical name for it is cholecalciferol or cholecalciferol, and it's a fat-soluble substance. That's important because it means that it's cumulative. You don't have to have some every day, but you have to have enough, often enough, to maintain a good level throughout the year. So you can store it in the body.
Okay, so apart from sunshine, where can we get our vitamin D from?
So the main food source of vitamin D is fish, particularly oily fish like mackerel, sardines, salmon and so on. But there is some in all animal food, so eggs, dairy products and meat have some, but sunshine is the best source. Now, you'll probably realise that people who live in the far north, like the Inuit people, who we used to call the Eskimos, for half the year they have literally no sunshine at all, and even when they do, they have to wear warm clothes that cover them up. So they have very little sunshine to make vitamin D. So what do? They eat loads and loads of fish.
So what would you recommend for somebody who follows a vegan diet?
I would recommend that they take vitamin D supplements, good pure vitamin D, and it has to be vitamin D3, not D2, because D3 is the natural kind that the skin makes in response to sunshine exposure.
Okay, so what should a normal level of vitamin D look like in one's body?
So the blood level of vitamin D ideally should be between 75 and 200 nanomoles per litre. Now some GP surgeries use a different set of units, and that would be micrograms per litre, in which case you need between 30 and 80 micrograms per litre. But most of them use nanomoles, so 75 to 200. Now I have to say, the goalposts have been shifted on this, because nowadays some surgeries are saying, oh, it's all right if it's 50. And I have seen some that say it's okay if it's 25. It isn't. That's too low. And there's an important historical reason for this. The normal range of vitamin D, the so-called normal range, as with the so-called normal range for all vitamins, was set many, many decades ago when we thought that vitamins were just something you needed to prevent a specific deficiency disease. So in the case of vitamin D, it was initially considered just something you need to stop the bones from softening, so to prevent rickets in children or osteomalacia in adults. But crucially, we now know that the level your vitamin D would have to be down at to get those diseases is very, very low. It can be low but not that low and impact your mental health and your immune system and your muscles, your heart and your lungs. So we need much better levels than those we need just to prevent rickets in order for our immune system to function properly. And most of us do not have such good levels. So, well, I was going to say this pandemic, the COVID-19 pandemic, hit at the end of a British winter when
indeed.
everybody's vitamin D levels would have been in their boots, very, very low, because we'd been for 6 or 8 months without proper sunshine exposure.
Yep.
Unless you're a gardener working outdoors all year round with your sleeves rolled up and wearing shorts or a short skirt, you cannot get enough vitamin D from the British sunshine. It just can't be done. Now that's the case even for a person like me with so-called white skin. But for anybody from Africa or the Caribbean or South Asia, you have more melanin in the skin. And that means it takes more sunshine to make the same amount of vitamin D. And this has been largely ignored, but it's incredibly important.
Have you yourself treated patients with low levels of vitamin D, and what happened when you supplemented with vitamin D?
I have. I mean, the lowest levels I see in most of my patients are around 20, but I have had several African and Afro-Caribbean patients who were very ill, I have to say, with dementia. And when I've measured their vitamin D levels, they've come back at 5 or 10. Almost unmeasurable. It should be 75 to 200, right? And in all these cases, the laboratory concerned has done the test again because they were so shocked at how low it was. This is what can happen if you've got dark skin and you don't eat lots of fish and you don't get lots of sunshine exposure. Really, as I say, you need to be outdoors from May to September with your sleeves rolled up and the lower legs at least exposed. Couple of hours a day in a British summer, and that's on the good days when it isn't raining, to not be desperately deficient.
So leading nicely on to the next question, which is who should take vitamin D supplements?
I think in a British winter we should all take it, but I think there are some of us who need to take more. So I would want most of us to be taking 2,000 international units from October to April. But I think if you have certain skin types, you need 4,000 IU. Now by that I mean anyone who's from Africa or who's Afro-Caribbean or who's from South Asia, that's India and Pakistan. And also there are some white people who are so pale, the Nordic and Celtic types with perhaps ginger hair, blue eyes and freckles, who can't sunbathe. They just cannot expose their skin to the sun because they don't make vitamin D and they don't tan, they just burn. So all of those people probably need to be taking 4,000 IU throughout the British winter. This is known, the information's in the public domain, it's been published in peer-reviewed journals that we all need vitamin D, and the darker our skin, the more we need, unless we're eating lots and lots of fish or doing an awful lot of sunbathing.
So, would you agree that taking vitamin D to prevent illnesses and diseases, such like COVID-19, would you recommend taking vitamin D to prevent something like that?
Yes, because we know it strengthens the immune system to protect against respiratory infections and all kinds of viral infections. There is, as I say, a vast amount of published evidence. And what I find disturbing, given that this is known, is why the knowledge hasn't been applied. So we know that the first 10 doctors to die from COVID-19 were all Black or South Asian health workers. We know that not only have deaths among these communities been disproportionate, but the sheer number of cases testing positive among this community has been disproportionate. It is not fully explained by how many Black and minority ethnic people are health workers. There are huge numbers. It is not fully explained by poverty or whatever. All these things are factors, but the vitamin D level is so basic and so obvious. And we know that the lower your level of vitamin D, if you have COVID-19, the more likely you are to be admitted to intensive care unit, and the more likely you are to die. Now, is there an element of racism in the fact that this knowledge is not more widely available?
Well, that's the question.
Maybe there is. Maybe there is. And whether or not that's the intention, That is the effect. So I feel very strongly that all of us, but especially those of us from minority ethnic communities with darker skin who need more vitamin D, must know this and must be fully informed.
It can be quite problematic not knowing these little bits of information that we can start to implement in our daily lives to protect us.
And that's why we're making this film, basically. There is a Labour MP who's originally from Bangladesh, I think, called Rupa Hook, who says, quote, that a huge number of eminent medics, right? That's not me, that's eminent medics, although it does include some of my colleagues. Eminent medics have written to her showing a vast slew of studies, these are her words, confirming what a big difference vitamin D makes. And it makes a difference at every level in an infection like this. So the lower your level, the more likely you are to test positive. And the lower your level, if you catch it, the more likely you are to get seriously ill and to end up in intensive care or worse. So the knowledge is out there, and one has to wonder why it's not being applied.
So vitamin D is just one supplement that we can take to boost our immune system.
Vitamin D3.
Vitamin D3 specifically.
Yeah.
What other nutrients and minerals does one's body need to stay healthy?
Thank you. That's a really important question, because of course vitamin D is not the only vitamin, and it's not the only one that supports the immune system. There are 4 others that are really important, and 2 of those are hugely important, and we need them in good doses. Those are vitamin C. Now you get that from fruit and vegetables, basically, raw fruit and vegetables. And unlike vitamin D, which is fat soluble, vitamin C is water soluble, and that means we pee it out. We lose it from our bodies every day, so we need some every day. And the next hugely important nutrient is not a vitamin, it's a mineral, and that is zinc. The immune system needs zinc for the white blood cells to do their job, which is gobbling up viruses and bacteria, and for the skin to heal itself, and for all parts of the body to repair. And we also need tiny doses of selenium and iodine. So that's the kit, and if you eat a really good healthy diet with lots of fruit and vegetables, you will get those things. But in a time of pandemic, I would say that certainly zinc, vitamin C and vitamin D do need to be supplemented. These are natural substances, and it might be worth adding that because they're natural substances, they can't be patented. There isn't much profit in them, and one can't help wondering if that's why there's been a fair bit of silence about them.
Very interesting.
Yeah.
Thank you. So, going back to your book that launched in January of 2020, just as the outbreak was beginning to take its course, could you tell us a bit more about the word seasonal that is attached to your book, and what does that mean in terms of the food that we eat? When should we eat certain things? And
yeah, sure. So our bodies are different at different times of the year, and the way we need to live and eat in winter is different from the way we need to live and eat in the summer. So, as I say in the book, it's natural to go outside and play and party from dawn till dusk in the summer, and it's more natural to hibernate in the winter. So the first 4 chapters of my book are winter, spring, summer and autumn, and they tell you what food is in season and what food's out of season, because of course the supermarkets want you to eat everything all the year round. And the 5th chapter is called Seasons of Your Life, so that's about how to live differently at different ages and different nutritional requirements at different stages of the life cycle. In the context of what we're talking about here, vitamin D, chapter 6 is important. It's called Nourish and Flourish, and it's about supplementing, why you might need to supplement, and with what, and how, and when. And the last chapter, chapter 7, is about toxins, and it's about all the poisons in our atmosphere, our water, our food, that are affecting our health in a negative way, and what we can do about that, and how we can avoid and indeed get rid of those substances out of our bodies and out of our lives.
And so it's fair to say that it's not just one thing that will help, it's
Absolutely.
a concoction of different things that we do in our daily lives that can contribute to having a healthier immune system to be able to fight illness and disease, those sorts of things.
Absolutely, there are many, many things that we can do, but in a short video we've only had time to talk at any length about one of them, which is vitamin D. Thank you.
Thank you very much, Jenny. It's been a pleasure.
It's been a pleasure.
It has indeed. Wish you all the best.
Thank you, and you too, Tyler.